Good day, viewers, and welcome to Beyond the Headlines. In a move that has sent ripples across the global health community, the newly inaugurated President of the United States, Donald Trump, has announced the withdrawal of the US from the World Health Organization. This decision was attributed to the organization's alleged mishandling of the COVID-19 pandemic and other health crises. The withdrawal could have far reaching consequences for global health and nations like Nigeria that depend on the organization's support.
Withdrawing from the World Health Organization, sir?
Ooh, that's a big one. So we paid $500 million to World Health when I was here, and I terminated it. China with 1.4 billion people. We have 350. We have, nobody knows what we have because so many people came in illegally, but let's say we have 325. They had 1.4 billion. They were paying 39 million. We were paying 500 million. It seemed a little unfair to me. So that wasn't the reason, but I dropped out. They offered me to come back for 39 million. In theory, it should be less than that, but you know. And when Biden came back, they came back for 500 million. He knew that you could have come back for 39 million. They wanted us back so badly, so we'll see what happens.
The WHO, which receives about 18% of its funding from the US, plays a pivotal role in financing health initiatives worldwide. Over the 2024 and 2025 budget cycle, its total budget stands at $6.8 billion, with the US providing significant contributions to critical programs such as HIV prevention, tuberculosis control, and vaccine distribution. Bearing this in mind, the WHO expressed regret over the withdrawal announcements, asking the president to reconsider the decision.
The World Health Organization regrets the announcement that the United States of America intends to withdraw from the organization. We hope the United States will reconsider, and we look forward to engaging in constructive dialogue to maintain the partnership between the United States of America and WHO for the benefit of the health and well-being of millions of people around the globe. WHO plays a crucial role in protecting the health and security of the world's people, including Americans, by addressing the root causes of disease, building stronger health systems, and detecting, preventing, and responding to health emergencies. For over 7 decades, WHO and the United States of America have saved countless lives and protected Americans and all people from health threats. Together, we ended smallpox, and together we have brought polio to the brink of eradication. American institutions have contributed to and benefited from membership in WHO.
The agency, as you know, relies on a number of donors, both from governments and private donors. And obviously, any shortfall from one group or one country will put additional pressure on other countries and other donors to step up.
I believe this is a truly historic decision. The United States really formed the World Health Organization in 1948 and has been its most influential and greatest funder for 75 years. This is going to make America decidedly less safe, less secure. And it's hard for me to think of any national advantage that we get. I only see us alone and isolated, not stronger.
For Nigeria, the organization's involvement has been nothing short of essential. It has supported vaccination drives, disease control efforts, and health system strengthening, with 5.84 billion allocated to the country in 2020 and 2021 alone. However, here are some key concerns for Nigeria. 1. Funding gaps. With the US withdrawing its support, Nigeria could face a reduction in WHO funded programs. Health experts warn this might stretch an already strained national health budget, increasing the burden of preventable diseases. 2. Vaccine equity. WHO's role in vaccine procurement and distribution is indispensable. Its involvement in initiatives like COVAX ensured COVID-19 vaccine access for Nigeria, and reduced funding could disrupt vaccine availability, particularly in lower income countries like ours. 3. Health security. The WHO's technical assistance and expertise are critical for disease surveillance and outbreak responses. A diminished WHO presence could hinder Nigeria's ability to address public health emergencies effectively. 4. Global health governance. As the US exits the WHO, there is speculation that other nations, notably China, may step into its role. This shift could redefine global health priorities, with potential implications for nations like Nigeria that depend on international cooperation. 5. Disease preparedness and response. The WHO has been instrumental in Nigeria's ability to dictate and respond to diseases like COVID-19 and mpox. A weaker WHO presence could leave the country vulnerable to future outbreaks. Whereby, on a second thought, why these challenges are significant, health experts also see an opportunity. The withdrawal could push Nigeria to exploit alternative funding sources, ramp up domestic investments in health, and forge new international partnerships. These measures could not only bolster the health system but also strengthen the country's economic prospects. As we navigate this new global health landscape, the question remains: how will Nigeria adapt to these changes? What measures should we prioritize to ensure that our health remains resilient in the face of uncertainty? Over to you, our viewers. What are your thoughts on the US withdrawal from the WHO? How can Nigeria prepare to address the potential gaps in funding, vaccine access, and health security? Do you think this move could encourage Nigeria to become more self reliant in healthcare? I love to hear your suggestions and ideas. Share your thoughts with us via our social media platform, Diaspora Digital Media, which is the DDM. Together, let's explore solutions to strengthen Nigeria's health sector. Stay tuned for more updates and analysis. Until next time, I am Nenyo Michaeline Ezine. Bye.